Assalamualaikum doctors. In this video I am discussing about eye swelling history. So we know first I am telling the eye swelling normally which history come. Chief complaints orbital cellulitis or nephrotic syndromes, sometime in aphaxis. So first I am telling the DD, periorbital edema, it can be bilateral or unilateral. So if it is unilateral, no fever, then insect bite or eye trauma and fever cellulitis, like our patient. Pictures. Bilateral is systemic signs of water overload like nephrotic syndrome. Bilateral change in the appearance of the eye, systemic sign of active thyroid hyperthyroidism. So eye swelling, we keep in mind that orbital cellulitis and the nephrotic syndrome mainly. So how can we check the history? First of all, chief complaints analysis as usual. Eye swelling. First question, is it unilateral or bilateral? Onset, course and durations, anything make it better, anything make it worse. Is there any diurnal variations? Any swelling in other parts of the body, sequence of the any swelling in other parts of the body, sequence of the swelling, red eye, excessive lacrimations, oozing, pus, affects visions, pain when moving eye, bulging eye, light intolerance, green and red color differentiations. Again I am telling, first of all, unilateral, bilateral, OCD, increase and decrease. Is there any diurnal variations, any swelling in other parts of the body? Very important. Swelling in other parts of the body, by that we understand it is orbital, periorbital or going any other cause. Okay. Then the sequence of swelling we ask, red eye, excessive lacrimation, everything eye related questions. Red eye, excessive lacrimations, oozing, pus, affects visions, pain during movement of the eye, bulging eye, light intolerance, green and red color differentiations. Then we go the general like fever, weight changes, level of activity, sleep, sting bite around the eye or elsewhere. Other concerns, any dysmorphic features, chronic any illness or long-term medical conditions. So chronic illness we ask because nephrotic syndrome is a strong differential diagnosis here, maybe diagnosed case. Relapse calm. CVS number of pillows, number, if it is increased then pillow before, no, more than one pillow, then pillow before. Chest pain, exercise intolerance, awareness of the heartbeats and blood pressure. CNS about sign of increased ICT, headache, fainted, altered consciousness level, unusual any movement, fits, hearing concern, unusual gait, facial asymmetry, urinary change in the pee color, amount, frequency, pain, frothy urine, recent bug, urinalysis, GIT increase the tummy size, tummy pain, loose poo, throwing up and yellow eye. Chest coughs and colds, recurrent bugs, rapid breathing, noisy breathing, oxygen saturations, skin spots, lump, joint pain, joint swelling, change in the hair and nails, hematology, pallor, bleeding, bruising, recent bugs, endocrine heat intolerance, blood sugar measured. Then past history 5T IOA, any trauma, traveling, transfusions, these are any team he's in following, treatment taking, previous surgery, admission, drugs, sting bite, previous admissions, these are. Parental history, if age is less than 1 year, ask about the birth weight and hypothyroidism screening. So hypothyroidism screening we need to ask, puberty if relevant, vaccination, missing any shots, extra shots, annual shots, allergy important, nutritional edema we ask, development plus growth charts, family history of similar condition and consanguinity, social financial plus home, psychological school impact, how does this condition affect the family. Also add on the history, repeated ear infections, nasal discharge, is it upper eyelid or lower eyelid, very important, upper and lower eyelid. Recurrent ear infection, nasal discharge because sinusitis, that is complicated with the cellulitis, sometimes it is present. Okay. Remember the DD I am telling, unilateral and bilateral eye swelling. Unilaterally local cause or anaphylaxis like allergies, sting bite, eye trauma, orbital cellulitis, eye infection secondary to facial palsy and exophthalmos. Bilateral nephrotic syndrome like fast diagnosis, relapse, steroid dependent, steroid assisted. If it is nephrotic syndrome, our history, of course, in the history we should need to exclude, it is Steroid dependent resistant by the history, relapse, which is the number relapse is going, or fast diagnosis. Then it can be nephrotic syndrome, orbital cellulitis, hereditary angioedema, cardiac failure, renal failure, liver cell failure, malnutrition like kwashiorkor. So diet history is very important. Malnutrition, one of the DD, protein losing enteropathy, and exophthalmos. Nephrotic syndrome on steroid decrease the immunity, orbital cellulitis. So these are the main nephrotic syndrome. What are the history question we ask? First of all, when diagnosis, where, by whom was it diagnosed? Test done, biopsy if frequent, steroid dependent or resistant. Steroids given, dose, duration, effect of the treatment, improved or not, recurrence of the symptoms when, during steroid withdrawal or after, side effects of the steroids, other drugs given, follow up. Team or follow-up visits, regular on treatment or not, who gives him the treatment, diary, duration, bracelet, emergency plan card, then operation, admission, frequency in ward or ICU, trauma, travel, transfusion, extra shots, vaccinations, and sting bite. Thank you.